The uniform officers like police, transport officers, excise, and fire officers are more involved in their sports activities and professional activities. They are vulnerable to many problems in bones and joints, like bony injuries, fractures, strain on the joints, strain on the back, neck, and there is a possibility of fractures, leads even malnutrition, deficiency problems. So these all have to be managed. When whoever doing a sports activities or professional training activities, they need to do a basic physiotherapy and warm-up exercises to go for professional activities or sports activities, so that the injuries or the damage to soft tissue or the bone and joints will be less. There is a possibility that in a professional training programs or the sports activities, there is a vulnerable sprains like ligament, fibers injuries, or there is a possibility of bony injuries, there is a possibility of joint dislocations, there is a possibility of soft tissue injuries, there is a possibility of fractures. So they should warm up themselves before going for a professional training or the sports activities, so that their ligaments and the muscles around the bone and the joint will be strengthened to protect in professional training programs or sports activities. When there is a injuries to the elbow shoulder joints, that should be excluded with a proper diagnosis like X-ray, CT and MRI. We should rule out the soft tissue injury around the joints and the bone to rule out and treat accordingly. The most of the people who go for long marching in the police and the sportsmen, they sustain foot bone fractures like metatarsal fractures because of the stress fractures. The stress fractures are more common in long walking or running sportsmen or the policemen, where there is a possibility of knee injury in police activities or sports activities, where commonly get injury of a anterior cruciate ligament, which really helps the support knee. This is the anterior cruciate ligament, this is the posterior cruciate ligament, these are the collateral ligaments, and then a meniscus. These are the most important parts of the joint, where there is a injury to the ACL is most common, PCL is less common, and then the injury to the menisci, that's a cartilage, is more common than the collateral ligaments. Obviously, under clinical examination and then a MRI will rule out the major problem in the joint. Sometimes there is a fracture in the joint or around the joint. That should be dealt in a proper way, that the sportsman can come back to his regular activities than before. The diagnosis in the sportsman, the policeman, must be very good and should be protocol managed. Hence, the management of the injury or the management of the diagnosis will be good, because their profession is their life, either sportsman or the policeman. Hence, both of them should take care of their health with the support of good nutrition, good physiotherapy, good warm-up treatment, and as well the training in the sports or professional activities. So whatever injuries happens should be diagnosed with X-ray, CT, MRI, whatever necessary, and then if necessary certain blood tests. So most of the sportsmen or the policemen will vulnerable for the shoulder dislocation, elbow dislocation, which are dealt immediately to relieve the pain. Sometimes even the hip dislocations also see in policemen as well as the sportsmen. So obviously these are the injuries we must diagnose properly, follow the protocols, treat according to the principles of orthopedic to recover best, better and early. Thank you.